UnitedHealthcare.com, a member benefit offered by American Gem Society. Wanted to thank you before I get started just for your time and interest in the program. So let's go ahead and get started. I am with MJM Global Insurance Brokerage. MJM is a multi-generational full-service insurance brokerage, and we have a niche in serving the jewelry industry. We've been doing it for over 70 years. We've got 4 locations throughout the United States. And me specifically, I am the Vice President of the Employee Benefits side of the house. I have over 15 years experience in employee benefits, specifically in the association, staffing, and franchisee space. I've been published on some of these topics, and I'm a standing member of the National Association of Health Underwriters. So what we noticed is that jewelers are vastly underserved when it comes to healthcare. Health insurance rates are slotted to increase 15 to 30% in the next year, which is just an unsustainable number, and it becomes really a big hit to the bottom line. And of course, all this comes at a point when unemployment is at an all-time low, which really increases the need for employers to offer employee benefits such as employer-sponsored health insurance. So what we did was we partnered with major associations, AGS being one of them, to get that purchasing power and really negotiate and leverage that against insurance companies. And what we're seeing on average is 8 to 12% savings versus what you would see outside in the ACA exchange or general marketplace from a local broker. We also focus not just on the insurance itself, because we understand that navigating the health insurance marketplace is oftentimes outside of the insurance because of high deductibles or sometimes just out of network type of situations. So we really focus not just on the insurance itself, but the true cost of care. And we do that with services such as telehealth, medical bill review, health advocacy, and a few more I'll talk about in a minute. But just to frame it, we really look at the overall picture of what the out-of-pocket expenses for healthcare is going to be. So how we do this is pretty simple. We have the website, jewelershealthcare.com. It's as simple as logging in, click the Let's Get Started button. You put in some basic information on your company, yourself, your group, and based on that information, it takes you to an Amazon-style shopping experience where you could look at the plans that are available to you given your group size and your zip codes. If throughout any time in the process you have any questions, we have ways for you to reach out beyond just the self-service portal. So you should be able to go all the way start to finish, just like you would in an Amazon shopping experience. But if you are like me and you're a bit old school, you don't have to touch the website at all. You can just call the 800 number anytime from 8 in the morning to 9 at night Eastern Standard Time. And we have licensed agents there that can help gather some information, work together some quotes, and really communicate offline, whatever is most convenient for you. We also have that same support through emails. And while you're going through the site, we have live chat support. So if you get stuck at any point, you don't have to make it a phone call. You can just do a quick chat and then help get through the part you're stuck on. So what is it that we're actually offering with this program? Well, what we're really offering is the ultimate in terms of coverage, choice, and savings. And when I say coverage, I mean we have 99,000 plans across all 50 states. So regardless of group size, location, and even down to zip code, we've got a large selection of plans. That gives you ultimate choice when it comes to major networks. So we have all of the major national networks built into this: Blue Cross Blue Shield, United, Cigna, Aetna, Humana, the names you recognize. But in certain states, you have major regional networks that are just as concentrated. And so I give an example in Ohio of Medical Mutual, but each state seems to have a bit of a major regional network. And so we've built those in too. And then we've tried to build in as many as possible the sub-regional networks because we realize that a lot of the smaller rural areas might have some niche sub-regionals that are strong in there too. So I give the example of Crystal One in New York. But the point is, you have the ultimate choice in terms of your network selection, the ultimate coverage in terms of the plans. And of course, this is all using the power of the association to leverage against insurance companies. And so what we're seeing is 8 to 10% savings on average on fully insured plans. And these are the plans you would be used to going out and purchasing on an ACA exchange or going to your local broker. These are major medical insurance plans. We also have an option for level funded plans. So still major medical plans, but they require a little bit of additional information from the insured side. And so if you're willing to provide a little bit more information, there's actually additional savings beyond the 8 to 12%. In many cases, we're saving 30 or 40% on insurance there. And those programs come with a dividend program where if your claims run well, you actually receive up to 50% of the unused premiums. So very, very cool plans depending on your level of what you want to provide in terms of information. Choice is yours. Of course, we also talked about the total cost of care, not just what the insurance itself costs. And so we built in Fortune 500 level services that we call Prosper Benefits. Prosper Benefits helps to utilize and navigate the healthcare marketplace beyond just insurance. And so some examples of this are telehealth. Now you have 24/7, 365 access to a board certified physician in your state. So this is all without no copay. Right on your cell phone, you can call the doctor and you've got them right there. Great service, does not take away from you being able to go to your local physician and do what you've been used to for the past 10 years. But this is great for services that need immediate assistance, that maybe are low level. You possibly would not have gone to a doctor or got some medical advice. Now you have the ability to do so. You know, if your kid's got a rash or a bug bite, or if you're not feeling quite well, they can actually prescribe some medications or recommend some over-the-counter stuff. And if it's something a little bit more serious, they can recommend next steps to get you further down the process. So it's great to have. Employee assistance program. This is really an extension of what we say when we talk about telehealth. This is really telemental. And what this allows is counselors that can help resolve over 80% of the cases that come to them. And that helps you to avoid a lot of the costs that come from the health insurance plan around your mental health benefits or your drug and alcohol benefits. So again, a very, very key, added service. And this is all brought to you, of course, by the association. These are built in at no additional cost to the insurance. Health Advocate is another one. So this is a concierge service that really does look out for you. They're a third party. They're unbiased, so they're not tied to the health insurance company at all. And if you go for a procedure and you need some help with the procedure, you want to find out a second opinion, they'll help set up that second opinion. If you have questions, you want unbiased answers, they're a great sounding board to kind of bounce things off of. They also do a lot of the heavy lifting, so they'll help you transfer medical records or coordinate it in-network, out-of-network type of things. They'll do a little bit of the shopping for you too. So if you need a procedure such as an MRI, they'll go out there and they'll find MRIs that are local to your area and come back with the pricing on those and also a bit of the quality, so you know what you're getting for your money. So it's a great service. And then lastly, we talk about the medical bill saver. And this is my absolute favorite of the services. So if anybody's had any expensive procedures happen and had the bill come back and it's wrong, they know what a nightmare it is to try to call the provider, call the insurance company, and work out all those details. It's really a foreign language to most people, and so it's a time-consuming procedure, and often we fail at it because we're trying to speak some other language that the medical billers just know and we're not privileged to. So this is expert negotiators that do that work on your behalf. They'll do the calls to the provider. They'll do the calls to the insurance company, and they'll work out the savings and come back to you with those out-of-pocket savings right to your bottom line. So it's a great service. Talk about easy enrollment. So the service of enrolling is super easy. And I say that because really this is another Fortune 500 level benefit that we're bringing to the smaller employer. So it's really easy in 3 steps. The first step is the employer completes their shopping and they choose the healthcare coverage that they want to offer from their employees. So they can choose up to 3 or 4 different plans from a carrier. And then they can choose their contribution level that they want to contribute as an employer. They don't have to, but they have the option to contribute whatever amount they would like. And once they do that, they fill out a quick carrier application, all again electronic. And from there, an email goes out to their employees. And now their employees get their own portal through which they can acquire the health care. They get the plans that the employer selected for the employee to choose from, and the contributions are in there as well, so they know exactly what the spend is. This is also very important because a lot of times employees are not the decision makers when it comes to health insurance, but rather the decision maker on the health insurance is at home. So this gives them a portal to take home. It gives them a single spot for all of their benefits to live, the costs, the plans, the specific SBCs on all of the different procedures and what the coverage levels are. And it's really a one-stop shop for the employees. And step 3 is that the employer themselves get a portal, and this helps manage this process. So they have in one place all of the employees, who's enrolled, who's waived. If you have a new hire and you want to give the new hire some benefits, this is where you go to do it. If you have questions, this is where all the support lives. And of course, if an employee wants to see anything in terms of what their benefits are, this is where an employer would go and gather it. So again, they don't have to worry about housing all that information or going to find it. It all lives right here, and it's very, very easy to access in their employer portal. So I know there's probably a lot of frequently asked questions that we get asked. So I'm going to go through a couple of the high-level ones that I get asked repeatedly, and then at that point I'll open it up to any Q&As from the group. But so let's go through those real quick. One of the questions I get asked is, do I have to be a member of an association to sign up? And the answer is yes. To sign up, you have to be a member of one of the participating associations. Currently, that's AGS, JSA, Jewelers of America, and DMIA. So the answer is yes. You have to be a current member to sign up. Another question we get asked is around the size of the group. So, hey, I have 5 employees, I have 50 employees, I have 1,000 employees on plan. Is this something that's the right fit for me? And again, the answer is yes. So what we do is we use that purchasing power to create and leverage plans and products that are unique and suitable to every size group. So really interesting things happen for groups over 50 employees. Now all of a sudden new things start to unlock for those groups. So depending, again, the system does all this for you, but depending on the size of group that you are, the system will open up the absolute best that's possibly available to you in that place for that size. How do I sign up? Well, again, that's really easy to do. It's the website, jewelershealthcare.com. Log into the website, provide some basic information, pick your plan, go through the application system, and then a unique email will go out to the employees so that they can have their portal. And as an employer, you'll receive your employer portal as well. Again, at any point in the sign-up process, if you need help, you have help through a chat, email, or a live contact center support. So what if I'm no longer a member of an association? Well, that's a great question. If you lapse membership at any time, what we do is we contact you within 30 to 90 days of your lapse, and we'll alert you of the possibility of cancellation. Because again, you must be a member of a participating association in order to participate. But our goal is not to kick you off of a health insurance plan. Our goal is to make sure that you have coverage. And so we're proactive about that, and we try to give you enough time to get signed back on and get on the program. So, okay, what if my plan doesn't renew for a while? It doesn't renew until January 1st. What do I do then? Should I just wait another month or two, or should I move in now? So that's a great question. We get that all the time. The answer is you can move on to Jewelers Healthcare plans at any time. It's not the same rules as the ACA exchange plans that are out there. The ACA exchange plans, they often have an open enrollment that usually starts in November and is only open for a month and a half, and then the window closes. So that's their rules, but you could move away from those plans at any time if you have another option. So certainly you can move into Jewelers Healthcare plans at any time. And the savings are there. And of course, we have the easy electronic enrollment, so it's not really a burden to your staff to do it. Renewal dates really isn't an issue. And then I get this question a lot. They say, hey, look, you said on average you're 8 to 12% savings. I went on, and it looks like my price is actually higher. And so what I would say to that person is there are many factors that go into the pricing of a plan. If you're looking at health insurance that's slotted to raise 15 to 30% in the next year, and you have an effective date that was 11 months ago, you're probably working off of rates that are 20% higher just by the nature of them. You just haven't gotten hit with the increase yet. network sizes, where your network is, the size of the group, whether you can get the dividend refund or not. There's tons and tons of things that will prevent it from being apples to apples comparison. So what I would say, again, we have chat, email, and phone help. Reach out. Say, hey, look, I'm not seeing where the savings are. Can you walk me through the differences here? We're here to help. We want to make sure we get your questions answered and get you the savings you deserve. So just to quickly recap, jewelershealthcare.com, we try to show immediate savings and give you very simple enrollment. On average, we're seeing 8 to 12% savings on the insurance, but we also focus on lowering your true cost of care by providing these Fortune 500 benefit services that help you to navigate the health insurance marketplace. And we provide easy electronic online enrollment, which is a higher level benefit that allows you to have easy administration when it comes to this stuff. So with that, that's the presentation. I'm going to open it up to some questions and answers, and let me know what you guys think. I'm not seeing any Q&As coming through. We also have the chat feature open, so if anybody wants to chat, they could type their question via the chat. Oh, I think I take that back. I think the chat's only open for us right now. But if you type in the Q&A, you can ask the questions. I don't see any come through it just at the moment, but we'll give it another minute. And I would also say that I have my contact information and also the website. Feel free to ask a question at any time. You have lots of channels to do so, and we really invite them. We want you to communicate and talk with us to let us know your thoughts, and more importantly, to make sure you get the savings and the quotes. Okay. Well, again, I don't see any Q&As coming through. You have channels to reach out if you do come up with questions. But if there's no other questions at this point, we'll close up. Which is saying, again, thank you for the opportunity and the time to explore this important member benefit. I know AGS is always looking for ways to improve membership, show value, and this is certainly one that we're excited to be partnered with. So let us know what you need, and we hope to talk to you soon.